my name is Katelyn and this is my presentation on inhalants. What are inhalants? Inhalants are drug substances that create chemical steam and mist that people breathe to experience an under the influence feeling. Inhalant drugs can only be taken by breathing in through your mouth and or your nose. Inhalants have many different medication types that can be found in hundreds of different products. Inhalants can often be found in your home, community, in medications, and local stores. Do you think these drugs are inhalants? These are all common household items that you find at your school and in local stores. Some of these items can be found, your parents using lighters, can be found in dentists or doctors or hospitals. Some of these items can also be applied daily to your body, like deodorant or hairspray or mousse. And you are right, these are all inhalants. Now here's a quick video for you guys.
They can find them at home. You can find it in your garage. Even in the classroom. Be aware.
The origin and history of inhalants. Inhalants began in ancient times where people would breathe in spices, oils, and different gases to change their mood. Inhalant facts and myths. So here's another short video.
Safer than other drugs.
Fact. Inhalants are very, very dangerous. A person can die after using them just one time.
Myth. Inhalants can't be that bad. Otherwise, you wouldn't be able to buy them.
Fact. Products used as inhalants are safe, as long as they're used in the right way and for the right purposes. Inhalants become very dangerous when they're misused in order to get high.
When it comes to inhalants, there are lots of myths.
So pay attention to the only true facts about inhalants.
So there's multiple different street names for inhalants. Air blast is a term for inhalants that is used for the Cool Whip bottles or aerosol cans. Bagging, using inhalants, used usually with a paper bag is the most common. Bang, to inject inhalants. Bullet bolt, term for inhalant. Highball is another term for inhalant. Huffing, to sniff inhalants. That's usually when you bring an aerosol can or a paint can up to your mouth and you sniff it, or a permanent marker or glue. Glading, to use inhalants. Bolt, bullet, dusting, poppers, quicksilver, snot balls, whiteout. These are all common names used on the street for inhalants. The category of inhalants are very difficult to classify. One classification system lists for 4 general categories of inhalants: volatile solvents, aerosols, gases, and nitrates, based on the forms in which they are often found in household, industrial, and medical products. Compounds of inhalants. Many inhalants can be purchased and found at local stores. It is hard to prevent their use because these products are found in many homes, workplaces, and communities. The inhaling of fumes from chemicals such as incense, oils, resins, spices, and perfumes to alter consciousness, or as part of religious ceremonies, dates back to the ancient times in Egypt, Babylonia, India, and China. The compounds are naturally occurring in synthetic compounds. Impacts inhalants have on the brain. Inhalants affect the brain in many ways, such as the central nervous system, which is located right here. It slows down the activity of your brain as well. Inhalants have short-term effects that are similar to alcohol effects on the brain. This includes slurred or distorted speech, lack of coordination, where you have no control over your body movement, the high feeling, dizziness, feeling of lightheaded, images or sensations that seem real but are delusions, which are false beliefs, less conscious or less in control, vomiting, feeling drowsy for several hours, headaches that last for a while. Impacts inhalants have on the body. The impacts inhalants have on the body consist of rashes around the nose or mouth that can be discoloration of yellow from different chemicals you have huffed or inhaled, irregular and rapid heartbeats that lead to heart failure and death within minutes. Suffocation can occur by replacing oxygen in the lungs with the inhalant chemical. Muscle weakness, loss of sense of direction, lack of coordination, moodiness, depression, serious and sometimes irreversible damage to the heart, liver, kidneys, and brain. Memory impairment, diminished, where you're not able to remember anything, your intelligence, hearing loss, bone marrow damage, death from heart failure or asphyxiation, loss of oxygen. How to administer inhalants. Inhalants can be inhaled by multiple different ways through the mouth or the nose, such as sniffing or snorting fumes from containers, spraying aerosols directly into the nose or mouth, bagging, sniffing, or inhaling fumes from substances sprayed or deposited inside a plastic or paper bag, huffing from an inhalant-soaked rag stuffed in the mouth, inhaling balloons filled with nitrous oxide. What is the duration of the effect? Inhalant effects typically last only for a few minutes. The short time frame effects of inhalants are dangerous. People who use inhalants often seek a state of intoxication by inhaling repeatedly. Inhalant use that is repeated in a short time frame will experience a feeling of less in control, experience extreme drowsiness, and lose consciousness. Signs and symptoms of an individual under the influence of inhalants. An individual that is under the influence of inhalants may act or look like they might have slurred speech, lack of coordination, no control over their body, dizziness, lightheadedness, where you feel like you're floating in the air, hallucinogens, where you feel seeing items that are not present, delusion, something believed that is not believed, dilated pupils, loss of appetite, facial rash, where the inhalant has blistered the skin, that is usually around here by the nose. You'll also notice a strange smell, a distinctive chemical-like smell that reminds you of fresh paint. Odors might also have marks around their mouth or noses, particularly if they're sniffing paint. Patterns of use of inhalant substances. Your dog runs to the door to greet you each time you come home. A student screams when they see a snake. You brush your teeth every night and morning before you go to bed. These are simple examples of pattern behavior. A pattern behavior is a way of acting and happens multiple times toward a particular object or situation. An individual using inhalants may become unfriendly and damaging towards common household items. Sometimes common household items, such as nail polish, spray paint, are used unfriendly and used for damaging reasons. Inhalants are steam and mist from toxic substances that people inhale in order to become under the influence or the high feeling. This includes experimental use, inhalant abuse, tolerance, overdose, or an overdose. Physical indications of dependence to inhalants. These The use of inhalants can damage organs in the system of the body that can damage your health. Inhalants have a dangerous impact to the brain by not getting oxygen. This can cause sudden or other physical effects such as brain damage due to lack of oxygen, spasms in the hands or the feet, hearing loss, suffocation, and loss of consciousness. Psychological indications of dependence of inhalants. Inhalants can lead to psychological effects such as loss of consciousness and cognitive impairment. Individuals may experience increased anxiety or depression. Psychological effects that may be experienced include the following: mood disorders, personality disorders, altered perception of reality, paranoia, and confusion. Symptoms of withdrawal from inhalants. A person who has been inhaling inhalants may develop psychological withdrawal issues, such as delusions and hallucinations. Physical withdrawal symptoms, though not as common, may result between 6 and 36 hours after usage and can include the following: hand tremors, agitation, which is a state of anxiety or nervous excitement, grand mal seizures, sweating, not being able to sleep, fast heart rate, and nausea and vomiting. What are the dangers associated with the abuse? The dangers that are associated with inhalant abuse that can be reversed are hearing loss, limb spasms, bone marrow, central nervous system, including the brain damage. Now I have another video for you guys.
Inhalants are thought of differently than other drugs because they're household items. You can huff it, you can bag it, you can sniff it. All of these things are potentially lethal. The idea that there are good ways and bad ways of abusing solvents is a myth. It's a dangerous myth. A lot of these products contain dichlorobenzene, and it's a chemical that is not canned air. They're extremely deadly, and they cause what's called sudden sniffing death syndrome.
Because of SNCS, it puts huffing up there with heroin as far as potential to die.
It's the least safe, in my opinion, of all drugs out there.
What effects does overdose have? Inhalants can create a feeling of disorientation, nausea, diarrhea, and nosebleeds. This affects individuals' experiences during overdose include hallucinations and drowsiness and coma states. Sudden sniffing syndrome that causes heart failure by the amount of effort after inhaling. Individuals that are under the influence may present behaviors such as jumping off high buildings, where they experience more risky behaviors and they take more chances. Professional diagnosis of specific abuse problems. The signs of inhalant effects are not always able to be seen. Effects happen fast and disappear quickly, and only small amounts of inhalant is required. Individuals purchase usually large amount of inhalant used in household items. These items will be stored in places not expected. Individuals that use every day may have a clear physical sign, bad breath that can last for hours, stains, paint, glitter, or odor on skin or clothing. Individuals may experience dryness and the huffer's rash, which may be yellow in color from nitrate abusers, or even facial or oral or nasal freezing. Individuals will present confusion, moodiness, and irritability. Impacts on pregnancy and risk of HIV. Inhalant use during pregnancy may produce effects in the baby similar to those seen in fetal alcohol syndrome. One study, for example, reported high rates of head and facial deformity, smaller than normal head and brain development, low birth weight, developmental delays, and other pregnancy and birth complications in infants born to women who inhaled solvents recreationally. Described a withdrawal syndrome potentially attributable to maternal inhalant use. Recent laboratory studies also have demonstrated evidence of growth and development aberrations, physical deformities, and other adverse outcomes. While discussion of these findings is beyond the scope of this paper, they have been achieved by and reviewed by Bowen and colleagues, Loveman and colleagues, and Hannigan and Bowen. Risk factors of inhalants. The individual is experimenting with substances that are illegal. For children, it's tobacco or alcohol. Positive substance use, attitude and expectancies, sensation-seeking personality, criminal behavior, low self-esteem, impulsivity, mental health concerns or disorders, example, depression, anxiety, or eating disorders, or ADHD, exposure to trauma at home or elsewhere. For at school, the risk factors are poor school performance, frequent absentees or truancy, lack of commitment to school academically or socially, conflict at school with students, teachers, or administrators. For your peer group, it is associating with peers who engage in substance abuse, involvement with gangs, overly strong peer orientation, and peer rejection. For at home, the risks are domestic violence in the home, parent and sibling involvement in substance abuse, incompetent or inconsistent of chaotic parenting, lack of supervision or monitoring, no warm, supportive relationships with any adult, lives in neighborhood with easy access to substances. There's multiple treatment programs for inhalants. One is individual therapy. This is working one-to-one with a trained therapist in a safe, caring, and in a private environment to explore their feelings, beliefs, or behaviors, work through challenging or memories, identifying aspects of their life that they would like to change, better understand themselves and others, and set personal goals and work towards desired change. Group therapy. This is a group of patients who meet and describe their substance abuse, that they're struggling together under supervision of a therapist. Family therapy. This improves communication and resolves the conflict in the home. Cognitive behavior therapy, which is known as CBT. This is a goal-based treatment, problem-solving and changing the behavior or thing, which would be the substance abuse. Recreational therapy. This is a person's level of functioning and independence in life activities to promote health and wellness, as well as to reduce or eliminate the activity of addiction. And these are my references. Thank you.